you know, having spine surgery is not a trip to Hawaii. That's a term that I was taught. And so we try other non-surgical things if possible. And it's sort of the rule of threes. Is what I like to call them. You know, one choice that you try to come up with is maybe do nothing. Maybe they don't need anything done. Maybe the problem is not as bad as they think. There are situations where it's important to do the surgery. It's important to have a spine surgery, that the spine surgery actually is the most conservative thing to do. I mean, particularly if you're running a risk of neurologic damage or, you know, being crippled or paralyzed or something like that. Most of the time, it's something that can be treated conservatively. And we tell them that waiting doesn't seem to affect the results, that you can have this operated on later if you don't get better with therapy or shots. So option number one is do nothing, wait and see how it goes. Choice number two typically is therapy, physical therapy of some type, and shots, injections. Everybody who leaves my office, typically the first visit they get a physical therapy prescription form. Even if they've had therapy, sometimes the therapy that they describe to me is not the therapy that I think they should have, or that they really didn't do the therapy long enough. So sometimes we restart that. Injections or shots in the spine, there are a place for that. They're not always curative, but they sometimes can make people better for temporary periods of time. And sometimes the injections help me intellectually decide what's wrong with them. Sometimes having a shot in their spine will help me decide where their problem's coming from. Choice number three, if they're a surgical candidate, meaning that a candidate is, sounds like we're talking about politics. A surgical candidate to a spine surgeon means that they have a problem that I feel comfortable dealing with, that I think has a good chance of being fixed or made better by surgery. And sometimes people aren't surgical candidates, sometimes, but we talk about that too.
Well, when does surgery become an option for treating back pain?
Surgery becomes an option when conservative care has not worked and the patient is still having problems. And the patient feels that it's warranted. You know, it's not just the surgeon saying, well, you need surgery. The patient has to feel like their problems are significant enough to warrant a surgery as well.